clinical photography guidelines for medical team, and there is a slash RAP insurance pick. This also training, excluding the clinical part or the technical part, I'm sorry. Yes, RAP should be, reception should be oriented. Insurance, which is, we call it RCM team, should be oriented. And of course, the patient education and communication should be included. And when we say that the team, a medical team, we include also the lab, the laboratory inside it. Okay, we built up this system since one year, but sadly, as part of the human paradigms, everyone needs to be economic to save his ATPs, ATP with this adenosine triphosphate. So everyone needs to save his calories. So rather than saying, I am going to do, it's too long, let's go, I'm gonna do. So sadly in business, this calorie saving mood. Anyhow, this is a well-known quote that photo is more powerful than 1,000 words. So this is very important to document our work with the photography. Our clinical photography, it is not the full dental photography. Our clinical photography, we refer here. Clinical photography, we refer here by SOPRO. It's like, it's part of generic name. When we call, give me carbonated beverage, we say just give me Pepsi or give me Coke. So it's the same because SOPRO has the innovations in intraoral photography. So we say it SOPRO photography. The scientific word is clinical photography, in which the photos that we do when we do clinical treatment. Okay? It is here mandatory for medical team and either required by other departments. And for doctors, especially this line is for doctors. Doctor, this is what will create your own word of mouth. Even it's not my facility, it's your own word of mouth. I know it is slow, it will only bring 20% by count. But believe me, these 20% are willing, when they see your photo and your magic and how do you do cleaning or how you do a root canal professionally with a rubber dam and with the inlay, even the general guys, even a general regular literate person will know what a rubber dam is. It's something for protection, something which looks safe. So yes, it is not the main marketing we are giving you from our pack. Many patients in which you are saying burglar patients, but believe me, if one patient coming from your photos, this is your own word of mouth, and he will be willing to pay 80% of your fees. You understand me, huh? So this for the doctor. Back to the clinical photography for the whole departments required to attend. It should be for the PEC, and the criteria is to be social media posting ready. This is we're gonna learn today, and we're gonna teach you today. So the PEC, you should export the photos as a ready made for social media. And also it should be RCM, revenue cycle management, or insurance following the insurance guidelines. I'm gonna endorse that in a while, because this is gonna save your money, especially in the insurance audits. And of course, for treatment purposes, and this is, believe me, is your medico-legal barrier. If you have an infection for a root canal and a patient go for suing you, complaining you, yeah, sadly, it is a SOP, the rubber dam. Although 80% of clinics, Dr. Asma, in Abu Dhabi not following it, but if someone goes to the DOH complaining you, I have pain, I have infection after a root canal treatment, if there is a rubber dam, whatever bullshit is inside, you are saved. Okay, so it's, believe me, you are gonna use it once or twice in your life, or every 5 years. This is my rate. I go every 5 years to the DOH, but believe me, it will be a life saving, like the basic life support. You see it in your life 2 or 3 times. I don't know, many of you did not see even a dead people. Me as a professional maxillofacial, I just saw it 5-7 times in my life. I have to be involved into a basic life support or even advanced life support, but it works. So again, photography for a treatment, medical, legal reasons, believe me, it will save you. I have just done yesterday a case patient complained, I did a restoration 2 years ago and it's broken. And by documentation, by minimal documentation, it's very obvious that the patient is bruxist. The story of yesterday, in which it was not professionally documented, but some photos helped us. So this is again I'm emphasizing the treatment part. طيب, there is some requirements. There is some requirements for the SOPRO photo. And each department needs its own requirements. So sadly, as a doctor, busy with the patient, busy with the over-treatment, busy with the patient waiting inside, busy with the delivery of the crown, which is not good in seating. You have to, only in photography, you have to fulfill these criteria. For the department of the RAP, the patient should understand what was done to him. There should be a title. There should be a title. I'm back to PEC. There should be a title. Yeah, Algin. Where is Algin? There should be a title for the visit. There should be a title for the visit based on our categories and subcategories. There should be a title. Crown or CAD-CAM or scaling or oral hygiene. So, and patient should understand this, and even I'm gonna involve my hosts and agents to check their photos to make if my host understands it, so definitely my patient will understand it. Number 2, of course, you follow steps of treatment as possible. Try from A to Z. I do remove caries. I do put a rubber dam. I make root canal cleaning, root canal widening, root canal closure. So it should follow steps that a regular people can understand it. Number 3, its format should be ready, as if this is going to be your own Instagram or your own Facebook. It should be as possible, ready to be posted. And we are planning to post twice or thrice a day. Then, although it is a medical photography, although this is a medical photography, kindly avoid medical terms or medical products. What do you mean by medical terms? Of course, a good focus should be there. No blood. No, you should go for like 30 seconds of removing of blood. I sometimes I do an implant in 10 minutes, and I have to have a good photos in additional 10 minutes, and we do suction, we do flab. Even if there is the flab, there is some shreds on the flab, we should clean it, we should cut it to have a professional photo as possible. No blood, no saliva, no food remnants, no piece of carrots or no piece of green leaves in between patient teeth. And sadly, yes, this has happened. For the requirements required by the treatment department, this is going to be the hands-on part, but are you going to finish? We should follow the 5-axis orientation. And this is going to be, we are late, this is going to be my hands-on part, but I'm going to pass it for a while. We should follow a sextant or half sextant or maximum magnification of a single tooth. we use bisextant, and this is a little bit terminology, medical terminology, so I'm gonna omit this part until the hands-on after 5 minutes or 10 minutes. If you go for a maximum one tooth, this one tooth shouldn't be chipped off or even a smaller. You cannot go smaller than one tooth. And the definition of one tooth is to be distal, the distal part of anterior tooth appearing and the mesial part of the distal tooth appearing. One tooth meaning to tell me this is a one phone, I have to see some space here and some space here. So this is also technical. I'm going to start immediately after this in the... And of course, we follow the clinical guidelines, like if the guidelines telling us all stains should be removed, so all stains should be removed. If you are going in the telling in the guidelines, no sharp angles in the CAD/CAM preparation, so please don't show me sharp angles in tooth preparation. If there is RCT should be full length, thick and obturated canals, please make the RCTs. I missed here, a rubber clamp or rubber dam clamp is there with a full length with the thick obturated canals. So follow the guidelines. Then I'll go for the last part, which is the insurance requirement. It wasn't new. We have been attacked many times. Every 2-3 years we have this attack. It happens to every clinic. So although it is not mandatory required by RCM, by insurance, they don't tell us you should record it, but this is the only way to prove that we did an inlay is to show them a photo. So what is extra requirements here? It minds the communication gap between insurance company. What is new here? You should follow. We said in the treatment, follow the guidelines. Here, additional, follow the EMR that you are writing. If you are writing, in this case, implant impression, and because of our technology, we are so fast, we can implant impression and delivery at the same time. You have to split photos to accommodate implant impression and implant delivery. Another extra thing, sometimes, which is rarely, but we're trying to make it as rare as possible. Sometimes we have problems in the approval, pre-authorization, blah, blah. So if the date is not matching, if the date of the approval is not matching the date of the treatment, so please, you have to mind the date. So this is only the extra. So every department, let's wrap it. You have to do photography. This photography, there is 3 people inside your brain. Of course, I know this is out. That's why we call you doctors and nurses high hand skills, high skill calibers. So being high skill calibers, your octopus, you remember last lecture, should be at minimal 4 and with a good tentacles. So we can, this is how you are. This is your salary ranking. To wrap up, we are required to make a clinical photography, and this clinical photography should match 3 persons or 3 departments. The social media guys, the treatment legal guys, and the insurance money guys. Okay? So the last part, this is of course mostly for the nurses. How to export photos. We have 3 steps. And it was 2, I added number 3, which is just preparation. Sharpen the soul. Prepare the case, create the internal PDF file, and export the PDF file. What do we mean by preparation? What is the title of the day? Mostly it is matching. Crown inlay delivery. It should be inlay delivery unless you missed the visit of the inlay preparation. So you have to know what you are doing. Implant impression or implant delivery. So please know what is the procedures or what is the visit talking about. Then as a doctor, take as much, it's okay. The photos are not that big in size. So to take photos as possible, and if you need to go for more decent, let your nurse delete, or you by yourself delete the excess photos. But take as much photos as possible. And remember, when you're taking these photos, remember the three persons inside you: the social media, the treatment, the insurance. After patient leaves, select the fixed orientation. I will mention now what is the 5-axis orientation when I start the hands-on. Then, so this is the prepare. Know what is going on, take much photos, then delete, fix orientation. Now you are ready. This is the prepare. Okay? Then how I create, we all know this. There is an icon, Sopro Document Center, and you're gonna follow, of course, most of you or all of you have done this. The number of images are 1. Give us, please make it as large as possible. No comments, please, because comments make the file smaller in size. The image size is 100%. The handwriting, no need for handwriting notes. That's it.
Our treatment planning cases, we are putting
if you have to, but whatever you add, it makes it a little bit smaller. So this is how to create inside the Sopro platform. Of course, this is Dr. Salim can run with you, but I think this is a daily practice everyone is doing. Then number 3 is to export. Press the print, export via print, either Nitro or you check the printer, not the regular printer, the internal printer, which is whatever PDF, Nitro PDF, it's a PDF file. Then please do, there's some glitch in the MySmile. If you make patient file name and name, it might catch with the same file, with the same name before, so it's gonna make problems. So please follow this, the year, month, day, then whatever the treatment done. Then save the file into the ordinary file, export to any file, external file. Then another step is to import back into the MySmile. What is our guidelines here? طيب. Doctora started to follow a chronological from 1 to 32, which should be like followed here, and we go by sextant, which is here. This is too distal for a sextant. When we use a sextant, we have our 5 axes. What is wrong in this? I'm gonna tell you what is the axis. Let's make a demo. So what do we call this axis? This is the x. So you go this and this. This is the x-axis. When we go like this, this is the y. Again, this is the x-axis. Okay? This is the y-axis. Okay? And what is this? Z. Okay, we still have, we all learned in school that it is 3, where are we? X, Y, Z, but sadly it is not. It is okay. So we do maximum by sextant or even half sextant. So can you tell me, Doctora, what is the difference between this and this? So what was the wrong? X, Y, Z. So the Z was wrong. That's it? X, it was, this is too much X. X, this is too much to expose. So X was wrong. Y was bad or good? Y is okay. Yeah, Y is okay. So we don't have a problem in X, Y, Z. I'm not gonna go for A and B for now. Okay, so does not look as a social media photo. This with the same things, with just 1 second extra. This look like with some editing, with some lightening, this can jump directly to the social media. So X, Y, Z. Of course, there is too much Z here. Let's go for another example. So we finished the X and Y and Z axis. X, Y, Z only if you are dealing with a dot on space. This is the 3 dimensions. If it is a line in space or an object in space, you have to add, it's also 3 dimensions. It's not the 4th dimension of time. It is also the 3 dimensions, but for an object inside an X, Y, Z, you have to describe it by axis. That's why we don't call it dimension. We call it axis. So it is not the metaphysic thing of 4th dimension of time. It is the same 3 dimensions, but because we are dealing with objects and lines, it's A axis and B axis, additional 2 axes. Let's see. You need to go for the canine area. What was only canine area? So what's wrong here? It's very obvious that the Z, even the X is correct here, and the Y is correct. 1 tooth below or 2 tooth distal, 2 tooth. So it's about the Z, X, Y, Z. طيب, let's go for a more complex case. This is the area of chief complaint. Okay. You are referring to here, this or this? This, huh? طيب. So it is X, but you make it difficult for the editor. Yani rather than making like this and make the whole, you lose all of this, you can tilt your camera to be in a professional X. So this is, yeah, correct. You are in the X. Y, almost Y. Don't count by microns. But the whole, to make this, you shifted the whole, the whole axis. But what is the other thing here? What is the other wrong here? Focusing. Of course, there is a shaky hand. What else missing? Okay, it's time to jump on it. The A and the B axis. Okay. This is the area of chief complaint. This is the area of chief complaint. It's here. X is correct. Y is correct. Okay. What was wrong? I have 2 things. I have the A axis and I have the B axis, which you distorted the photo. But to fix the B axis, we have to fix the whole photo. We have to the B axis is fixable by losing the photo, by losing the orientation of the photo. Making like this is different like this. So, let's see. This is ready for photography. This is, you have to tilt. So this is mistake which is fixable but with a price. So the B axis is the rotation. The A axis, let's see what is the A axis. Is the tilt. Either this way or that way or perpendicular. So axis should be, A axis should be 0 or in the other way or 90. Take some time, please. And no need to be lazy and to take photos like this. This main mistake appear in the, let's go for, avoid this. Which better to go for the social media? So A axis is the tilting, B axis is the rotation. We can fix rotation, but we lose lots of orientation. Okay? Here I have a mistake in the B axis, by the way. But I was focusing only in the A axis. So it needs some orientation, which is a little bit difficult in women, but it's achievable. We are not asking for the 6 sigma photography. We are asking for a standard 5 sigma photography. Let's go for another trial.
Question, doctor.
So you come in return of the question.
The reference is always the same in all the photos?
The reference is the very, very famous photography of very, very famous reference. This should be your reference.
Yeah, that's what I'm saying. It's always this.
I am Nawat who's creating this. Yes, this is our reference in Arch. It should be appear like this. When we make it like this, yeah, it should be appear, yes, this should be look up. Clear? So let's wait. So it's gonna be now Dr. Ammar photos. Yalla. Start. The tilting. I lost you, but let's go one by one. Take your time. Of course, you have the advantage of knowledge now. We go sextant. Sometimes we go extra if the canine is stubborn. Okay, this should go for 2 minutes. Of course, you're having too much advantage. There is no cheeks, there is no tongue, there is no annoying patient. Of course, when I go for the detailed photography, because of the distortion or the eye fish focal length of this, you cannot go more than half arch. Single arch, even full arch is even not accepted. طيب. Some fine tuning is required. Which is better, ya doctor? One. Yeah, so we have a problem with the z-axis. طيب, let's go for a criticism for this is a batch of Dr. Ammar. Can I listen or can I hear any comments?
That one down there, maybe it's a y-axis. Yeah. No. And that one is also the same one, actually.
We miss something, by the way, in the anterior teeth. We are all missing that anterior teeth. It is required to go for a 90 degree A-axis tilt. Axis, by the way, axis gonna be no problematic if you jump. B and A-axis gonna be no problem if you jump by 90 degree. 90. If B-axis like this, you make it like this. You tilt the camera 90 degree. It's okay. Tilting, it's okay to be 0 or 90. Sometimes, of course, in the buccal area, it's difficult, so we force ourselves to go for 45 degree if it is buccal posterior. but I'm seeing here in the standard. You forgot, by the way, photography of the chief complaint. It needs a specific to photos, and I'm missing here the buckle, the 90%. Did you write these things? That's these guidelines. I need it to be time is running. I have to stop now, and this is the requirement. It should be created by you, created by the doctor, selected by the nurse, selected and nursed by and sent by the nurse, and audited before sending to the. We have patient.
Patient, yes.
Any questions? So please give your paper to the staff. I'm gonna send you the new copy. I'm expecting from today. There's gonna be dramatic changes in the pic photos that we send.